Right. Hello, Veronica Thomas. Thank you guys for joining us. We are live for this Q&A session this evening. I'm Dr. Deigni. I'm a board-certified plastic surgeon. I practice in Houston, Texas, and I really thank you guys for joining us. Post your questions. Don't be shy. We are here talking about body contouring procedures, including body makeover, breast lift, breast augmentation, liposuction, lipo360, BBLs, the drain, which is my signature procedure, and many more. So please go ahead and post your questions. I also have a set of questions that I've jotted down from different social media platforms that you guys have been asking this past week and last week. So hopefully this will be a good session, very educational for everybody. Share the link with your friends, especially if you know they want to have plastic surgery anytime this year. And also putting your information in the bottom left of the screen, there should be a form where you can put your name, email, phone number, and then a brief message about what you're interested in having done. And we will reach out to you and guide you through the process. It's always a pleasure to have you guys come in from out of town and even out of state, and then put a head or face, I guess, to the TikTok username. So I've had a couple consultations come in today, and they've been following me on TikTok, and it's really nice to see that the community is coming in and they're getting all the information that they need through these channels. And they do their homework, and they're very well versed and comfortable by the time they come in for their surgeries. Thank you, everyone. Please share the link with your friends. Let them know that we are live, taking questions from the audience. Let us know what you're interested in discussing, and I will also review some of the topics that a lot of people have asked questions about over the past week or two, and we will make this entertaining and educational for everybody. Like I said, I am Dr. Deigni. I'm a board-certified plastic surgeon. I practice in Houston, Texas. You can see that here on the green screen. We got our phone number, 281-724-3138. I'm doing this live on multiple platforms here, on YouTube and Instagram, in addition to TikTok. So trying to hit as many platforms as possible to get some good engagements. So go ahead and ask your questions. I'm going to start with a very common question that everybody asks, or at least wants to know. Do I need to lose weight before surgery? Or, who's the ideal candidate? Or kind of like, what is my BMI? What is my BMI for these procedures? So an ideal candidate has a BMI of 35 or less. We want you to be in that category because it decreases your risk of complications, decreases your risk of surgical wound healing problems, and actually allows you to be able to recover well and do much better. So my BMI cutoff for these body contouring procedures is a BMI of 35 or less. So let me give you some examples as to what that is. If you're 5 foot tall, your weight shouldn't be more than 179 pounds. If it's higher than 179 pounds, you need to bring that down. If you're 5'2", the max weight is 191 pounds. If you're 5'4", it's 204. If you're 5'6", 215, 5'8", 228. And if you're 5'10", a maximum of 240 pounds for us to be able to move forward with these body contouring procedures. So I've operated on patients who've had their BMI at 35 and less, and they've done extremely well. People will ask, what are the common complications or setbacks that you will see? And for these patients, it would be some small wound healing problems. So like, for example, on the incision, there may be a part where it kind of opens up a little bit. Then we have to do some It's not letting me pin the comments. Interesting. All right, so maple syrup. Sorry, so for that you have to do some local wound care and get you to heal. So maple syrup is asking, I'm 130 kilograms. I have an apron belly, sub-fat. Can I get a tummy tuck diastasis to later lose the visceral fats? So 130 kilograms, I need to translate that to pounds. We need to know how tall you are as well, because we need to find out what your BMI is. So 100 kilograms to pounds, that puts you at 286 pounds. So unless you are 6'4", we definitely need to get you to lose weight to be able to get you to that safer zone before we move forward with surgery. So let us know what your height is, and that'll kind of tell us how much weight you need to lose before we can move forward with surgery. Thank you for the question. I appreciate it. Putting your information in the bottom left of the screen. We'll be happy to take care of you. All right. So, hey, LaWanda Wilson, how are you? It's been a while. I was thinking about you last time. I don't think I saw you on the live. Okay. So, Andrea Agudo 998 is saying, just had a tummy tuck 7 days ago and got the tape removed. What can I put on the incision now? I would defer to your surgeon. I don't recognize the username, so I'm not sure if I operated on you or not, but definitely talk to your surgeon's team and ask them what your surgeon recommends that you put on your incision. For me, for all of my patients, I have them start scar treatment at about 1 month out from surgery. And I want their scar to heal well before we put anything on it. So definitely discuss that with your surgery team. All right, let's see here. Okay, so Maple Syrup 1 is saying, I've got issues walking and you're 5'7". So at 5'7", with 280 pounds, you need to get to at least 222 pounds. So that's a good 60 pounds that you need to lose. So for you, I would recommend some weight loss treatment. So it could be, one of the medications, the GLP-1 medications. That could probably help you lose that weight. Or some patients, if you're a candidate, they will undergo some type of bariatric surgery to lose the weight. And once you've lost the weight, then we can actually help you do the body contouring and remove the excess skin and fat that is remaining and that is bothering you. All right, so nice to see you, LaWanda Wilson. Thank you so much for joining us. It's been a while. I hope all is well with you and your family. Calidre M. Queen is, Cali Dream Queen. Oh, that was funny. Hello, nice to see you. Thank you for joining us. I guess you're coming in from the West Coast. Here I'm trying to read this in Spanish. This is too funny. All right. We got a follow-up question by Gwen P saying, Cali Dream Queen, how much did you lose with the bypass surgery weight and now? Good question. Kimberly is saying, I am 5'10" and 230 pounds. What is a good number to be at before the tummy tuck? Thanks. So at 230 pounds at 5'10", you definitely will qualify for being below a BMI of 35. But if you can lose another 10, 15 pounds, I think it will be to your advantage. So contact us, put in your information in the bottom left of your screen. You should be able to lose that within the next month or 2 months at most. And that's perfect timing, because then we can get you in and do the appropriate lab work, and then get you on the books for your tummy tuck. Again, I do the drainless tummy tuck technique, which is a lot easier and smoother of a recovery than the traditional way of doing it. So definitely contact us. We'll be happy to guide you through it. Cali Dream Queen, first time joining. Wonderful. Okay, thank you. Thank you. Hopefully you'll get a lot of information from here. I do these live sessions every Tuesday and Thursday, time permitting, if I'm not operating or traveling. And my goal is to give you as much information so that you're well versed to be able to ask appropriate questions when you go and meet up with the surgery team that you want to have surgery with. So definitely, um, um, follow us, like Deigni Plastic Surgery, and go through my content. I have a lot of videos where I explain a lot of things to get you ready for your surgery. Maple syrup 1. I say, my doctor says no to GLP-1 diets, don't help sleeve. My sister did it, she regrets it. So definitely, I would say discuss it with your physician. They need to give you an option that's going to work for you. There are definitely ways that they can help you and take care of you. Thank you very much for that heart there. I appreciate that. All right, let's see here. Okay, so Terry is asking, are you very aggressive with Lipo 360 to shaping the body? Yes, I am. If you want an aggressive Lipo 360, I will be aggressive. I go by what my patients want. Some patients want very aggressive, really snatched. Others want just a little bit off and some mild shaping. So it depends on what you present with and what you want to have done. Definitely, we can tailor it to what you want. Jacqueline Allen, 55. I've had 2 C-sections and a splenectomy. I have a long scar on my stomach. Can I get a tummy tuck? Good question. I've operated on patients who've had long scars, especially on the right lower quadrant area, and I've been able to successfully remove that scar so that now they only have the scar that goes below the bikini line, which is beautiful. So it depends on what you present with. Once I examine you and feel for where that scar is and how long it is and what your excess tissues are, I'll be able to give you a much better idea as to what we can do and if we can remove it all. But definitely give us a call. Our phone number is 281-724-3138. Hey, Lindsay DeMario, how are you? So nice to see you from the ATL. I hope you're doing well, my brother. Thank you for joining the live. Okay. I've lost about 150 pounds. Congratulations, Cali Dream Queen. Very happy to see that you've made some significant progress there. If you have a lot of loose skin and deflation around your body, you want to get that taken care of, by all means, contact us. We'll be happy to take care of you. We do body contouring procedures. We love working on patients who've had massive weight loss so that we can actually help them feel much better in their body and see the results of all the work that they've done to lose that weight. Kasu 2M, hello, first time in here. Wonderful. Thank you for joining us, and I appreciate your gift. Ask your questions. We'll be happy to take care of you, okay? Anything you can do for keloid skin. My surgery scars are keloid. So the main thing, a lot of patients come in or tell me that they have keloids, and when I examine them, they don't have keloids. They have what is called a hypertrophic scar. It's completely different. So the first thing I want you to do is, if you've had surgery, definitely go back to your surgeon who did your surgery, and they can examine you to see what type of scar has formed. If it is a keloid, then we have to treat it appropriately. If it's a hypertrophic scar, there's other things that we can do for that as well. So definitely, please follow up with your surgeons, with your team. If you can't, but you're in the Houston area and want to come and see us, we can definitely get you in for a consultation and we'll take a look at it. All right, wonderful. Thank you for joining us. Absolutely. I think you'll be very happy. A lot of my patients, as you can see on the live, have had surgery with me and join us back. We have formed a wonderful community. We appreciate them sharing their experience, and some of them are actually coming in for additional procedures. So it's always nice to have that support and know that we've done a good job on them the first time that they want to come and have more surgery for the other things. Thank you, Lawanda. I appreciate it. Okay, Jackie Marie saying, yes, because I got in alive. She was talking about surgery, and oh my God, I got out of there quickly. Yes, definitely. Lawanda, yes, thank you. Your scar is so thin. I can hide it under a string bikini. I'm so happy for you. Thank you for sharing your beautiful results with us. Please go ahead and send us some selfies. We will print them out and put them on our selfie wall in the office as well, and also share them on We'll share them on our social media platforms as well. Oh no, she was misinforming everyone. Oh my goodness. Yeah, so please, guys, be very careful. There's a lot of misinformation on these social media platforms, whether it be Facebook groups, YouTube, TikTok, Instagram. Do your due diligence. I'm a board certified plastic surgeon. I have my certification from the American Board of Plastic Surgery. That's the top of the top. That's the gold standard here in the US. So if you are considering having surgery with somebody, please do your research. This is public knowledge. Go to abplasticsurgery.org, which is the American Board of Plastic Surgery website. On their homepage, you will see an area where you can click on and say, it says, is my surgeon board certified? Click on that, put the surgeon's name. If they don't show up, then either you misspelled the name, so definitely correct the spelling if you misspelled it. But if they don't show up with good spelling, then they're not board certified, and they may not be plastic surgeons. They could be a cosmetic surgeon, which is a doctor that has undergone some course. It could be a couple weeks long to get certified in a specific procedure, and then they title themselves as cosmetic surgeons. That is completely different than a plastic surgeon like myself, who has completed 6 years of full residency training, where that is all we do. Plastic surgery, day in and day out, that's what we do. And I've done 2 additional years of fellowship training to specialize even more. So that's 8 years of cumulative training. You cannot compare that to somebody who's got a 3-week course in liposuction. That is definitely not comparable. So please do your due diligence, do your research. American Board of Plastic Surgery. So you want the certification from the ABPS. Go there, figure it out, and make sure it's good. Yes, none of your business. I definitely wanted to point this out too. Ladies, make sure your hemoglobins are good. So we talk about these medical problems that we need to make sure that they are adequately controlled. And unfortunately, if your hemoglobin is too low, in my instance, if it's less than 10, we have to bring that hemoglobin up before we move forward with surgery, especially for these body contouring procedures that are very big, where there is some blood loss. Hey, what's up, Ismail? Nice to see you. Thank you for joining in. Hope all is well. Take care, brother. We got to make sure that your hemoglobin level is safe, because safety is my number one concern for all of my patients. We want you to be safe going through these. We want to give you beautiful results so that you can actually enjoy them long term. So we'll get you there, not your business. Okay. Looking forward to be able to operate on you. So thank you so much for coming in for your pre-op visit. We started with a consultation virtually. So for all of you guys who are out of state or out of town, coming from the neighboring areas, whether it be Austin, Corpus Christi, El Paso, Dallas, Texas, Fort Worth, or even out of state, Louisiana, Georgia, Florida, New York, California. We got people coming from all over the place. We will start with a virtual consultation to get the ball rolling, get your information in. You'll put in your medical history, send us some pictures so I can get acquainted with which areas you want to get worked on. And then when we meet virtually, we'll have a very good conversation, and I can come up with an appropriate treatment plan for you. All right, Kasu2M is saying, I have an umbilical hernia and 3 C-sections. Can I get a tummy tuck? Yes, you can, depending on how large your umbilical hernia is. Typically, we'll have you get it fixed by general surgery, but if it's small enough, we can fix that during your tummy tuck. But as far as like the C-section, it doesn't really preclude you from having a tummy tuck. I've operated on patients who've had multiple C-sections, and they've done extremely well. So very good question. Okay, Delia is asking, would you do liposuction on A diabetic that has an A1C of 7. Yes, that is my cutoff. 7 or less, and we're okay to move forward with surgery. If your hemoglobin A1C is 9, 10, 11, 12, anything high, we have to bring it down to 7 or less. So you would qualify as long as you don't have any other medical issues. We will be happy to get you in and do the liposuction BBL on you. I've operated on a patient that has type 2 diabetes. When she first came to see me, her hemoglobin A1C was, I think it was 12. And I told her we couldn't move forward. She was devastated, but I encouraged her. We got her to physicians, got the appropriate workup, and she got the appropriate treatments, and a doctor that was able to actually really bring her hemoglobin A1C down. Her blood sugars were much better controlled. She got it down to 7 or less, probably like I think a 6.5 is what she got it down to. We proceeded with surgery, and that was probably, it took, I think it took about 9 months for that to happen. But she came in and she understood the reason why. And once we did the surgery, she was extremely pleased. It was dramatic for her to get her lifestyle change. It really helped her a lot. And now she goes to the gym 3 times, at least 3 times a week. She has completely flipped her lifestyle. And she doesn't even look like her before pictures at all. It's fantastic how much she's improved and changed. And I've posted her pictures before, and I've gotten a lot of questions by people wondering if it's the same person. It is, but it's amazing how much people can really improve and better when we do all of these steps in the right direction. So that's good. For pricing, Sweet as Ab is asking, Lipo360, Tummy Tuck. Now, so for pricing, please contact us. On the bottom left of the screen, there should be a form. My patient coordinator has all the pricing. She'll be able to give you an estimate. I only know the starting price for drainless tummy tuck. That's my signature procedure. I do a lot of that. It starts at $11,500. So definitely, even for the price range for the BBL, please contact my my office. Our phone number is 281-724-3138. And we also have a form here. Just put in your information. We'll reach out to you and we'll be able to give you a quote or at least an estimate and a budget so that you can have an idea as to what you need to prepare for these procedures. Kimberly is asking, how is the pain from a C-section? Guys on Instagram, go ahead. I'm listening, okay? You guys can post questions as well. I'll be happy to answer them. Thank you for participating. Kimberly is saying, how is the pain from a C-section compared to the pain from a tummy tuck? Is it similar? So when I ask my patients who've gone through the C-section and then they come to me and get their drainless tummy tuck, once they recover, they tell me, I would say, of course, everybody heals differently, but the majority by far say that the drainless tummy tuck is a lot easier to recover from than a C-section. That kind of makes sense because in a C-section, the surgeon has to go through multiple layers, your skin, your fat, and your muscle layer as well, to go inside your abdomen to get to the uterus. Whereas for the tummy tuck, we only go through the top layer, the skin and fat. That's it. We don't go through that muscle. So it is painful, and it's an extra layer when you go through the muscles. Oh, look at this patient, Chastity R. Thomas. You love your results. I love my results. Thank you so much. I haven't heard from you in several years. This is a patient of mine that I've operated on probably 4 years ago, I would say. 4 or 5 years ago, way at the beginning when I first started on my own. I'm glad you joined us. Thank you so much for sharing your results, and I appreciate it. Stay healthy, continue to exercise. Your results will continue to get to stay for a long time. So that's good. Rare Precious Jewel. Hello, what actually is the body lift and the recovery time? Hello, thank you for joining us. The body lift is a procedure that combines the hip lift and butt lift with the drainless tummy tuck. So essentially your scar will go all the way around your belt line. So it goes from the front all the way to the butt crack. and it allows me to actually treat the sagging hips and the buttock area, because there's people who've lost a lot of weight, 100 plus pounds or so, they'll have a lot of sagging. And I treat that by removing it and pulling everything up. So I'm doing a lift, a body lift, a hip lift, butt lift. And then I do the drainless tummy tuck with the Monsplasty to also lift up the fupa area. And that gives a very nice contour for my patients. So that's what it is. Recovery time, most of my patients will wean off their pain meds within 5 days after surgery. They'll be walking upright during that time as well. They come to see me a week after surgery, and the majority of them are standing upright off their pain meds. Some of them will actually be driving themselves in for the appointment. Otherwise, you're able to go back to work usually by that second week. And then from then on, you increase your activity levels in the gym doing aerobic activity. And then you're back in the gym doing resistance training, light resistance training, core exercises around 6 months. So a month and a half out. It's fantastic. Glamo 360, Mia Lawson. Are the massages included with the drainless tummy tuck? So that's the great thing about my drainless technique. You don't need lymphatic massages at all with the drainless tummy tuck. So the majority of my patients don't. You can get massages if you want to. I'm not opposed to it, but it's not required. The majority of my patients recover without lymphatic drainage treatments when I do the drainless tummy tuck, and they do extremely well. We do the lymphatic massages when you combine it with liposuction. Catwall, hi, how do you do loose skin? How do they remove the loose skin? So I cut it out. So I use techniques to remove the loose skin that is bothering you all the way around your belt line. I can do it on your arms. I can do the breast lift if you have a lot of deflation of the breast in the chest. I also can do the thigh lift. So a lot of patients will complain of some loose skin in their thighs, and it rubs and it bothers them. And I can do that as well. So definitely put in your information in the bottom left of the screen. We will be happy to take care of you, reach out to you and answer your questions and guide you through the process. LA, Texas, Tiger. Louisiana. How long is the body lift surgery? Shortest to longest amount of time? It depends on the patient, but it's on average. On average, it's about about 4 hours of surgery. On average, it's about 4 hours. It could be a little bit less if you're petite, or a little bit more if there's a much higher BMI, or if you've had previous surgeries with scar tissue, or if you have hernia. So, but it's around 4 hours of surgery in my hands, and I do it without drains. The full body lift is without drains. Claudia, oh shoot, you just missed it. What happened? Let me get back to that question. How much are the consultations? So to book your appointment is $150, and that goes towards your surgery credit once you book with us. Hello from Serbia. All right, wonderful. Vesna Ruteshik. I don't know if that's how you say it, but wonderful. That's the first time I had somebody tune in from Serbia. Nice to meet you. Ask your questions. I hope all is well out there. All right, let's see here. Who is pinning these questions? Me. Okay. You're pinning them too fast and remove them too fast. All right. Okay, Delia is saying, I would like to come in for a consultation. Wonderful. Put in your information in the bottom left of the screen. We will reach out to you, and my patient coordinator, Linda, will guide you through the process, and we'll book you for a consultation. Absolutely. Link in bio. Christy Reed, have you ever heard a pet facelift? I've seen they do them in Miami. I have not. I don't know what a pet facelift is. There's a lot of new names for different procedures. I would have to research it and see what exactly it is, but I've never heard of one. Link in bio. Hi, 6415. Hello. All right. Okay. I want this so bad, but it's 20K plus. Yes, Claudia, it depends on how many procedures you tack in. It can go anywhere from $15,000 to $25,000, depending on the types of procedures that you want to combine in your body transformation. I've had patients who've put money aside regularly, who save it. I have other patients who do that and also finance. We do have financing options available, 4 of them that we offer: Patient Fi, Cherry Financing, Alpheon, and Care Credit. So definitely contact us. We'll be happy to guide you through the process. And I have some patients who actually stage procedures if the budget is not there and they can't afford the full $20,000 or $25,000. We can break it up into several procedures so that it's easier for you to manage as well. Glamour 360, Mia Lawson. What are some things that will not get you qualified for a tummy tuck? Okay, so anything that will disqualify you from being under general anesthesia. So it could be a recent heart attack. It could be a BMI that is higher. For me, specifically for the tummy tuck, a BMI that's higher than 35. Uncontrolled medical problems, so diabetes, type 2 diabetes, if your hemoglobin A1C is higher than 7, so 10, 11, 12, 13, that will disqualify you from these procedures. Let me give you at least one more. Your hemoglobin level. We just had one. None of your business, just mentioned that. If your hemoglobin level is 10 or less, less than 10, so 9, 8, 7, that's extremely low. That is too much anemia. We have to get your hemoglobin up. We won't be able to do the tummy tuck. So definitely contact us. We'll be happy to take care of you. Mini BBL, Lady Godiva, Mini BBL. So Mini BBL is patients who have a smaller BMI and don't have as much fat, but they do have some. So we can contour it and then don't want too much of a large change in their buttock and hip area. So we're limited by the amount of fat that they have, but that's what a mini BBL is. All right, so we got a question on Instagram, Skylab Recovery. How many out-of-town patients do you normally see monthly? It depends. Some months I'll see quite a few, others it fluctuates. But we take patients from out of town and also out of state and even out of country. We've got people coming from Canada, from Mexico. We've got some people following from Europe as well, and even Serbia. And so some of them sometimes will be able to actually make the trip to the U.S. and come and see us for their surgeries. So we accommodate out-of-town patients all the time. So we're happy to take care of you as well. So reach out to us, DM us your information, and we will get you on the schedule. Lady Godiva, can someone of a higher BMI get a more natural BBL? So for these procedures, we want your BMI to be 35 or less. So even with a smaller BMI, you'll still get a natural result. Now, if you have a high BMI, it puts you in a category where you are more at risk of surgical complications. So we definitely want to be able to get that down as much as possible. Okay, so Delia is saying, I have a surgery scheduled for March in Houston, and they're telling me it has to be 6.9. Give us a call. We'll be happy to take care of you. You can't reschedule. Oh, okay. Well, like I said, if you want to be with us, definitely come and see us. Oh, you mean you want to have it done in March because you probably already have that time? Contact us. The sooner you contact us, we can see if we can accommodate you on the schedule. We'll do our best to get you in, okay? Especially if you already have that time committed. We've already done that on some other patients of mine. They had already booked surgery with Mia Aesthetics. They went there. They really did not like it at all, and we're actually scared about a lot of things. Definitely please do your research. They had not met with a surgeon at all throughout the whole pre-op time and everything. And I'm not even sure if they met them the day of. Regardless, we were able to accommodate them. They had already had that surgery time booked. So they took some time off. They were able to contact us and we were able to get a quick turnover. We can't guarantee it for everyone. Of course, it all depends on my availability and also the surgery center availability. But contact us now. Let us know if we can, what we can do. So I mean, get with us, get a consultation so we can actually start the process and see if we can get you in for your surgery during that time. With a drainless tummy tuck, do you create a new belly button? Yes. So your belly button, your belly button is still attached to you. Okay. I have to cut around it so I can actually pull the skin on top all the way down, cut the excess, and then I poke a hole to poke your belly button through that. That's how I do the belly button, but I actually design it myself and make it look really nice and cute. So go through the content on my TikTok content. You'll be able to see the before and after pictures, and also on my website at DeigniPlasticSurgery.com, you'll be able to see the before and after pictures for the belly buttons and see that see the results. Jennifer Alexis is asking, what is the BMI limit? So 35 is my cutoff. Anything higher than that, we need to bring that down, okay, for safety reasons. All right, so wonderful. Jackie Marie said, in response to one of the questions, I had no pain. The only thing I felt was tightness. Yes, so you're going to feel some a sensation of tightening because I actually fixed the separation muscles. So you will feel that initially until you kind of like get used to that. We have to bring those muscles back in, so there is tightening there. But otherwise, she said she did not have pain. TikTok is back. Really? It's available on the App Store? Oh, wonderful. Huh? Since today? Yay! So people can get it. Oh, amazing. So happy. So happy. We love TikTok. So you guys, if you updated your phones, upgraded stuff, who knows, or lost TikTok, apparently it is back and available on the App Store. So please go ahead and download it. Tell your friends who've lost it and have them download and come back and join us. Jennifer Alexis is asking, how much is the body lift? Please contact my office. This is our phone number, 281-724-3138, or put in your information in the bottom left of the screen. My patient coordinator, Linda, will be happy to give you an estimate. I don't have the pricing with me, and she will be happy to give you that information, okay? Thank you very much, Rare Precious Jewel, for filling out the form. I appreciate it. We look forward to taking care of you. Again, like I said, we take care of patients from all over the country, and also out of the country in different neighboring countries, and also from out of different continents. New Empire Entertainment, I guess. Hello from Connecticut, USA. Where are you located, please? We are located in Houston, Texas. Connecticut, Northeast. It's got to be cold up there. I know we're in the 50s here in Houston today, and it's really nice. I like it. But I'm sure it's a lot colder up there in Connecticut. I don't think I could do that with all the snow and everything. But we would be happy to take care of you if you want to come down to Houston. We've got people that fly in from all over the place. Definitely the Northeast is included, especially with people from Washington, Maryland, New York, New Jersey as well. I'm not sure if I've had anybody from Connecticut. You'll be the first one. We'd be happy to have you in. That girl can cook. How long would I need to stay in Houston after receiving a tummy tuck and a Lipo 360? So typically you'll stay anywhere between 5 to 7 days. It's about a week. So because you come and see me a week after. So the quickest turnover for my patients was about 4 or 5 days. So that's about the time that you can expect to stay in Houston. If you want to stay longer, by all means you can. I have some people who stay here 2 weeks if they got friends or family that they can stay with and they want to. That's fine. But otherwise you'll stay around 5 days, 5 to 7 days. And contact us. We will give you all that information. Very good. Very good. All right. So we got some people back on TikTok. I love it. Okay. So next. Okay, let's see here. Waving to everybody. Hey, thank you very much, guys, for joining us. Post your questions. I'll be happy to answer them. Okay, that girl can code. Thank you. You're welcome. You're welcome. Absolutely. Contact us. My patient coordinator, Lida, will guide you through the process. We'll give you all the information. We're here to educate you. And if you choose us as your surgeons, we'll be happy to take care of you. And I appreciate everybody who's had surgery and who's still joining us on these lives. Thank you so much for sharing your experience and for letting them know that there's nothing to fear. We will take great care of them. So very good. All right, who do we have on YouTube here? Anybody want to put a question or a comment? Please go ahead and let us know what your questions are. Okay, I appreciate it. Okay, so Rosie Chapman is asking, okay, Tara Lee, what is body contouring? So body contouring refers to shaping the body. So the way I do that is with multiple different types of procedures. So it could be liposuction, it could be surgical excision, actual doing removal of skin and fats. Rosie Chapman 430, what is the price for under eye bag? So you're asking for lower eyelid surgery. Please contact us. I don't have the pricing. Putting your information in the bottom left of the screen, my patient coordinator, Linda, will be happy to reach out to you, and she will give you a ballpark estimate for these procedures so that you can budget appropriately. All right, let's see here. Megan Morrison, I asked if you have plus size clients. I do. So max BMI is 35. So when you put in, so go to Google and type in, thank you very much for the thumbs up, guys, on YouTube. I appreciate it. If you type in BMI calculator, you will be able to find the NIH website and go to their calculator, put in your height and weight, and we want to make sure that your BMI is not higher than 35. If it is, say for example, you're 5'4" and you weigh 225 pounds, that's over the limit. We want you to be no more than 204 pounds. So anything lower than that will put you in the safe zone so that we can move forward with surgery. So definitely putting your information in the bottom left of the screen on TikTok there should be a form that you can fill out, and we will reach out to you and guide you through the process, okay, and help you out. Thank you very much. Much appreciated. And thank you guys for sharing the link and for telling your friends that we are live and taking questions. Keep posting your questions. I'll be happy to answer them. So now we've talked about quite a few things, the Lipo 360, the drainless tummy tuck. Okay, so another question that people ask is, can you do the BBL and the tummy tuck together? Yes, you can. You can combine these procedures. So it's Lipo 360 to get the fats and contour your body even more. And then we transfer that fat to the hips and butt for the BBL part. And then we do the drainless tummy tuck to really fix the front as well of your belly. But we can do all of that together. Jeanette So is asking, I want to know if you have an age limit. So no, there is no age limit. Age is not the limiting factor. For my patients and for my practice when I do surgery, it's your overall health. I've operated on patients in their 40s, 50s, 60s, 70s, and they've done very well. As long as you're healthy enough to undergo general anesthesia for us to actually move forward with surgery, you're going to be able to heal well. Then we can go ahead and do the procedures. But if you have medical conditions that are not optimized, so you've got diabetes, your hemoglobin A1C is 12, for example, that's not appropriate for us to do surgery, whether you're 25 or 60 years old. If you have high blood pressure, you're not taking any medications, we have to get that under control. If you're anemic and your hemoglobin levels are 8 or below, that's way too low. We have to get them up to a minimum of 10, ideally 12. So these are all things that we do to make sure that our patients that we select are healthy enough to be able to move forward. If you smoke, you have to quit smoking, things like that. So we have to make sure that we get you in the safe zone. And age is not really a limiting factor. Resilient 57. All right, let's see. How long after one surgery can another be performed? It depends on what surgeries we are having done. So, say for example, we work on your tummy tuck. You want to do a tummy tuck, right? But you don't want to do it at the same time as your breast. You want to do your breast later on. You can come back within 3 months to get your breast done. That's not a problem. But if you want to do, for example, we do a tummy tuck and then you want to do a lipo 360, we will wait about 9 months for your tummy tuck to heal before we do liposuction over that area. So it all depends on what areas we're talking about. If it's completely different areas, like I said, the tummy versus the breast, it could be the tummy versus the arms. We can do surgery relatively quickly after you've healed from your first procedure. You're very welcome. So Jeanette is following up with another question. I'm 53. That age is good for a BBL. Absolutely. I've done it. I've done BBLs on patients who are in their late 50s, and 60s. So you'll be, yes, it's fine. As long as your BMI is good and we can move forward with surgery. Absolutely. Put in your information and come in and we will be happy to take care of you. Okay. All right. So Tara Lee is asking, repost your question, Tara Lee. I don't think we saw it about the pituitary. So repost it. I didn't see it flash up. Yeah. So Tara Lee, we didn't see your question about a pituitary. It never showed up. So please repost it and we'll be happy to take care of that for you. Okay, Jeanette, so I think you gave us your phone number. Can you actually put it in the, fill out the form? There should be a form on your TikTok screen on the bottom left of your screen. Click on it and put your information in there. And that way my patient coordinator will reach out to you to get you that information, okay? All right. 240-353-2786. I'm just going to jot this down just in case my patient coordinator can reach out. But definitely, it's a lot easier if you put your information in the bottom left of the screen. Okay. Please repost. I have several right now. So Tara Leah, I'm not seeing your questions, so keep reposting them. Sometimes they don't show up. TikTok removes certain questions. You know, I mean, they have their own algorithm. So please repost it. We will get to it once it comes up. So all right, if you have somebody traveling, where do they stay? So patients who travel, they'll stay either with friends or family if they have some in Houston. If they don't, they'll stay either at a hotel or at an Airbnb. The way I do my procedures is to make your recovery as smooth as possible. Otherwise, you can also stay at a recovery home, but you don't have to. You don't need skilled nursing facilities to be able to recover from these procedures that I do. I make sure to close all the incisions up. I do everything to make your recovery as smooth and easy as possible. All that we require is that you have an adult with you that can supervise you and help you in case of any emergency. Jazz, can you do a rupture, taken out, already one implant left, need redone, thinking tummy tuck? And lipo also. Yes, we can do revision surgery for you. I've operated on patients who've presented with ruptured breast implants on one side, and then I had to redo both and redo the breast lift to really readjust. Absolutely, you can come in. We'll be happy to take care of you. Put in your information in the bottom left of the screen. I'll have to examine you and see how you present, and then we'll be happy to take care of you. Clamor 360, Mia Lawson. What are some risks doing a tummy tuck? So risks are pretty much for most of the surgeries is risk of infection, risk of bleeding, risk of seroma, which is a fluid collection. There's a risk of wound healing problems, delayed wound healing, adverse scarring. So your scar can heal thickened or widened or inappropriately, or you can even keloid. Specifically to the tummy tuck, there's a risk of blood clots that can form, or DVT, and we definitely want to avoid that. So I put all my patients on blood thinners when I do the tummy tuck to take care of them. Okay. All right, Tara Leah is saying, I have no pituitary gland and require prednisone prior to and during surgery. That's a good point. Okay, I'd have to research that a little bit more because we definitely want to see, have you worked with anyone of this nature? No, I haven't operated on somebody who does not have a pituitary gland, but it's not something that we cannot do as long as the anesthesia team is comfortable being able to do that. And we have to work in conjunction with your endocrinologist as well, so that they can manage your hormone levels appropriately. Then we can move forward with any surgery that you want to have done. Of course, when you do steroids, prednisones, and things like that, that can also impair your healing process. So we definitely want to be able to coordinate with your endocrinologist so that we can optimize you for the period of surgery and then make sure that you're able to heal well. Follow-up question. We already answered that. Oh, are the same risk doing it drainless tummy tuck? Yes. It's the same risk. So there's the drainless tummy tuck decreases your risk of seroma. And I would say probably also infection because you don't have the drains where infection can go through the drains. But by and large, the risks are the same. It's pretty much based on the whole, technique, the surgery, the risk of blood clots and things like that. That has to do with the general anesthesia, being under sedation, doing surgery and things like that. But we always put compression stockings on your legs. And then when we wake you up, we make sure that you start moving immediately. I have my patients start walking the day of surgery. But great questions. Yeah. Don't forget to put your information in the bottom left of the screen. We'll be happy to take care of you. You're very welcome, Tara Leah. I'm glad we were able to answer your question. And thanks for your patience. Like I said, sometimes TikTok doesn't post the questions. We don't get to see them. So if we missed it, just go ahead and repost them, and we will be happy to answer them. Wonderful. All right. Let's see here. Who else? You're very welcome, Glamour360 Mia Lawson. Thank you for your questions. You had some very good questions tonight. And like I said, put your information in. We'll be happy to take care of you. We'd be happy to see you for a virtual consultation if you're not in the Houston area, or in person if you're able to come in for me to examine you and see you. Wonderful. Let's see. One more topic before we call it a night. Okay, we talked about that. Lymphatic drainage after a tummy tuck. Somebody asked that question. With my drainless technique, you do not need to get lymphatic drainage treatments. Brittany B, if someone has a high red count on labs, will you need labs redone? So it depends on your level. It depends on the levels. We would have to see what your labs specifically are, which cells are high, what's going on, and if it is. It all depends. So, okay. If you do a virtual consultation, do you meet the day of the surgery or a few days before? Yes, great question. So for our traveling patients, we will typically meet the day or two before your surgery. So for example, I see my patients on Mondays and Thursdays. Most of my patients will come in probably on a Monday to have surgery either on Tuesday or Wednesday, and then they'll follow up with me the following Monday. That's usually how we do for our out-of-state, town patients. But that's a very good question. Yeah. So we will meet together first time virtually. I want you guys to be able to meet with your surgeon. It's very important that you meet with your surgeon before you even go to have surgery or go to their office. You have to meet with your surgeon that's going to be operating on you so that you can get a feel for how they are. You feel comfortable with them. You ask all the questions, they answer your questions, and you're comfortable with that. I also meet my patients preoperatively at least once, and then the day of surgery. So you'll see me at least 3 times before you have surgery with me. Resilient 57, after surgery, how long does the patient remain in your facility before being allowed to go home? Okay, you will stay until you wake up enough to be able to go home. So all of these procedures are same day procedures. So you'll go home. Some patients will stay about 2 hours. Some patients may stay 3 hours. It depends. Or some patients may stay longer. It depends on how long you take to wake up. But you're going to be leaving the same day. You're not staying overnight. Unless you decide to stay overnight, you've planned for it, you want to stay overnight, and we alert the facility. We say this patient wants to stay overnight. All of these procedures are done same day, so you can leave. Jackie Marie, how long is your special going on for the fillers, doc? I need to get there before it's over. Come in, we'll take care of you. Come in and we'll take care of you. Call my office. Linda will let you know. We'll book an appointment for you so we can do the fillers for you. All right. Happy Valentine's Day, everyone. Enjoy the weekend. And I hope that you guys will be safe, everybody, wherever you are. Have a wonderful evening. We're going to call it a night. I usually do about an hour, so we're coming up on the hour. And I wish you all a great weekend. God bless you. Take care. And again, follow us. Go through my content on TikTok. There's a lot of information there. And until next time, hopefully I'll see you virtually or in person, or next time, Tuesday, 7 p.m. Central Standard Time. Take care. Bye-bye. All right, guys. Thank you for following us on Instagram. Have a wonderful evening. Bye-bye. YouTube. There we go. You're the last ones. We got nobody following us. But we got a thumbs up. So check this out, Denis. No. Okay, we got one thumbs up from the live. So thank you so much. Signing out. Good night.